Good afternoon, everyone. As parents, we always try to take the best care of our children, from best schools to best institutes for their co curricular activity. We make sure that every need of our children is being taken care of. And of course, when it comes to health, we parents forget everything else and put our children's health as number one. But do we know it all? Or are we missing out on something important that can impact our child's well being? Hello, everyone, and welcome to yet another live session by Momspresso. Today, we are here to talk about something as crucial as brain fever that affects our children in early age and what is the right time of protection against it. We have with us our expert, Dr. Mohit Vohra, Director and Consultant, Sashak Child Care Center, Jaipur. Thank you so much for joining us today, Doctor.
Good afternoon, Amrit. Good afternoon, one and all who are present there.
Great.
Please. Yeah,
Thank you, Doctor. Thank you for taking time out for this live session. So, moving
my
quickly
pleasure.
into the conversation, let me start by asking you a simple question that will help us know more about the basics of brain fever. What exactly is brain fever and why are children more prone to it?
I think that's a very important question, Amrita. The audience here should understand what exactly is a brain fever. So, when you look at brain fever, there is brain and there is a fever. Now, what is a fever? Fever is actually a symptom. Now, this symptom can occur due to lots of causes, any cause in the body. So, if you have, throat pain with a fever, we call it URTI. When you have a cough with a fever, we call it lower respiratory tract infections. When you have a diarrhea with fever, we call it acute gastroenteritis. So, a fever which is involving the brain as a primary place of infection or inflammation is called a brain fever. So it is a medical condition where part of the brain is inflamed. That is what we should understand. If you look, just look from the outside, there is a skull. Everybody, all of us know that. Now, what happens besides beneath the skull? What is there? So inside this skull, the cranial cavity, there is a brain, and the brain is being covered by membranes. The three membranes which is adhering the brain. So these three membranes act as a protective layer of a brain. When these get inflamed, when these get infected, we call it meningitis. How does this get affected? There may be many causative organisms. It may be a virus, it may be a bacteria, maybe a fungi, any of the causative organisms reaching by the blood to the meninges, causing inflammation of brain or the meninges. We call it meningitis. Normally, bacterial meningitis, they are more severe or more serious as compared to the bacterial ones. Now, the another question which you asked, why the children are prone to brain fever. Children keep on moving here and there. Children don't pay attention to the hygiene. They're touching something, eating something, drinking something. So that's a very important role. And the most important is the immunity. The immunity children have is not up to that level because it is being developed. They are developing the immunity. So that's the reason children comes in the vulnerable group as far as we talk about brain fever.
Thank you so much for that very clear explanation, Doctor. This is great information. So, what will be the protection against brain fever, Doctor?
Look, to protect from any disease, what do you expect? The point, first of all, as I said, hygiene is very important because it's an organism which is going into your body. So
Right.
if you're taking, that protective barrier is broken, you are prone to get infection. So first, most important is the hygiene, which is very important. Second comes your immunity, how your immunity. So that relies on your nutrition and your genetics. That's very important. And third, what happens when some invaders come in our country? Our soldiers are ready, they have their guns, you enter, we'll shoot you. So we have to prepare ourselves with such kind of a guns. And what is that called? That is called a vaccine. So that's very important for us to understand. We have vaccine if we are vaccinated, and in any case that protective barrier is broken, in any chance, by any chance, that organism enters into the body and we have that gun, our vaccine helps which has already sensitized our immunity to produce the bullets, to produce certain antibodies to attack those virus or those bacteria which are acting as an antigen. So that's very important for us. I think that these three things, just sums up everything. We must protect our children by these three things.
Thank you so much, doctor. I love the analogy that you gave, like we are protecting our bodies just like the soldiers protect our country. I think that's a wonderful analogy and it'll help us parents understand so much better. But I'm not sure how many of us actually know about meningitis and meningococcal vaccine in details. So it's great that you've provided this information. And you also mentioned the right age. So could you please tell us the right age at which a child should be vaccinated against meningitis?
Look, when I talk about meningitis, as I said, there are various organisms which are attacked.
Right.
If I talk virus, I talk bacteria. In bacteria also, it's not only one, but there are various organisms. So what is important, what is dreadful, today we are talking about the meningococcal meningitis, and that is what we should understand. Because it is the government policies, it is the WHO policies, it is the Indian Academy of Pediatricians Academy which decides the vaccination policy for the country. So it is IAP which decides, gives us the guidelines, which most of the pediatricians follow those guidelines and vaccinate our children. So the
Right.
guideline says, yeah, the guideline says that young children, as soon as 9 months onwards, so 9 months to 24 months means is the period where you need to vaccinate your child with this typical vaccine of meningococcal meningitis to save him. So, but the initiation as sooner the better. As soon as it is done, that's the great. So what I tell you is start. There are two doses to be given. So one at 9 months, and then followed by 3 months another dose is being given. So start as soon as possible with this weapon which I told you is very important. That's the
Great.
right age.
Great. Thank you so much for sharing that with us, doctor. I'm also very curious to know, and I'm sure a lot of the parents watching are also curious to know if there are any consequences of not taking the vaccine.
Look what happens. You take a vaccine, you are protected. You don't take a vaccine, you are not protected. Means you are at risk. So consequences of not taking a vaccine keeps you at risk for the disease to be caused by that organism. If any of I told you the protective barrier broken, you get a chance, organism comes inside your body, you are not vaccinated, you get affected by a disease. And what how does this disease present? Please, all of us should be aware that this is a deadly disease. There is an acute presentation, means a child may die in less than 24 hours. Or there is a subacute presentation where we have some long-term consequences of this disease, which comes in form of deformities, in terms of seizures, in terms of low brain hallucinations, lots of things like that. So that's what the parents should understand, the long-term consequences of the
Not.
vaccine not being given to their child. They are being, proposed to. That's what I
That
think.
is actually really scary to know, and I'm glad that you're raising awareness about it and telling so many parents about it. So I'm sure our audience has gotten to know a lot of new things today, just like I've done, and I can see a lot of questions coming in. So let's take on a few of those questions and see we can answer those. And we'd like to get our queries answered by you, Doctor. So our first question is from Samira, and she asks, "How effective is the meningitis vaccine?"
That's a very good question. Everybody whosoever is taking a vaccine, the first question is how effective the the disease, the particular vaccine is. That's a lovely question, but definitely yes, it is quite effective. If you look at the studies we have, if we talk about the efficacy and the effectiveness of the vaccine, actually when the vaccine is given to a child, it contains, there are some components. There are, like you have been hearing these days, COVID variants. So there are components like A, B, C, Y, W. All these, there are various components which we should understand. So against type serogroup type A, the vaccine we have has the effectiveness, which is the most common type of this meningitis in India and Asia. This vaccine is effective 96 to 98%. 96 to 98%. If we talk about, on the whole, the vaccine about all the four serogroups, the effectiveness and the efficacy, ranges from 85 to 98%. So that is what do I mean by that? Suppose the next question the parents ask, what happens if we take this vaccine? Did a child not get a disease? That can be again a query. If we are
Right.
protected, so what happens? Look, first of all, yes, there are 85 to 88, 90% chances that your child will not get a disease because the vaccine you have given has been shot. The organism has been shot dead by that. But by chance, the immunity is very less. By chance, the organism gets a chance to grow, the vaccine is still able to help. Because when I say 96 to 98%, parents start thinking, why not 3 4%? 3 4% is not working or what? It is working, but the consequences of the disease, the seriousness of the disease would be far far low. So that is what we should understand, ki how and what exactly is the effectiveness and the efficacy of the vaccine. I hope I'm clear, Samira ma'am.
Yes, I think that you've answered the question brilliantly, doctor. So our next question, doctor, is from Shubhangi, and she asks, "At what age should a child get the meningitis vaccine?" I know you've already answered this, but maybe a little bit more clarity. And I, as a
Yeah,
mother,
yeah.
also wanted to ask you that I've heard of booster shots also for the vaccine. So can you please throw some light on that as well?
Of course, yes. Indian Academy of Pediatric Guidelines says the best age to give meningococcal meningitis vaccine is 9 months of age. So 9 months as soon as better. 9 months is the age we must keep in mind. This is another time when you get another vaccines of MMR. So the point is 9 months of age, the first dose of a vaccine. Second dose 3 months after. Or supposedly you don't give it 9, you may give it 10. You don't give it 10, that doesn't mean you have not given 9, you can't give it. So from 9 months to 24 months, when I said, is the right time, the right age when you can give your child. But of course, sooner the better. If you start giving it 9 months, that will be the best time. Because lots of studies have come in, lots of eye openers are there which says that as early the protection is given, as early, okay, there are more chances of saving the lives of the baby from this deadly disease. So 9 months is the time when you have to vaccinate. Now the question, Amrita, you asked me booster. What
Yes.
exactly is a booster? Booster is again what happens when you give when you give this vaccine in a small dose. Okay? It makes some antibodies to this level, say. When you give a second dose, the antibodies are raised to this level. After
Right.
some time, say 3 years, 5 years, 10 years, they start fading. They start fading because
Okay.
they're not working like your everything. You're not using a TV, fridge, anything in the house that requires maintenance, doesn't it? Same way. So they start fading. Now, when they're fading, and at that time you just give a booster dose, means boosting the immunity which you have already acquired. Booster is an injection of the same product, which is boosting the antibodies of the vaccine which has already been acquired to a high level. So,
All
which
right.
was when you gave for the first time, say it was 5. When you gave for the second dose, it was 50. It faded to 40, 35. You give a booster, it is 350. So now these 350 antibodies, ready in your body to bring any soldier they'll hit, to bring any invader they'll hit. So that's what is the role of a booster. Now coming to this vaccine booster, as far as this, we have not yet, there are no recommendations yet in India by the specific bodies for the booster. But yes, if you look at abroad, look at other countries, we get some idea. Yes, there are boosters, especially after 5 years or the adolescent's age, because that is the time, because this bacteria basically is a carrier
Okay.
means it stays in the body, where
Mhm.
in the nasopharynx. Now this is a nasopharynx, your
All
nose
right.
and the
Okay.
pharynx, so it stays there, it's a carrier. So the chances of this, when you come to the hostel, you go to the dormitories and all these things, the chances of getting infected more. So in abroad, it has been recommended, especially at the adolescent age and a little later ages also. But in India, yet now there are no recommendations for booster. But sooner, I believe, on these bodies, the government will come with the booster dose as well. I hope I'm clear, Amrita. regarding your
Yes,
booster query.
yes, yes, absolutely, doctor. There's a lot of clarity on that fact. In fact, I think this is one of the reasons why one of my cousins, when he moved to the US a couple of years ago, he was asked to get and he was going to stay in a dorm. So I think he was asked to get the vaccine before he came. I think it's a
Yeah.
rule that is, it's a mandate that it has to be done, right?
Definitely, it's compulsory there. When you go abroad, you need to get yourself vaccinated by meningococcal. Also, in cases of a liver transplant, you need to
All
give this
right.
vaccine every 5 years. All immunodeficiency diseases, we've been giving this vaccine
Hmm.
every 5 years because
All
we
right.
don't want this deadly bacteria in anyhow go inside the body.
Awesome, awesome. Also, this is a new fact that we've all learned today that it stays in the nasopharynx region. I think it's very important to know that and how easily it can spread. So that's great information. Thank you so much for sharing that, doctor. So our next question is from Gunja, and she asks, "Is it true that meningitis can cause permanent brain damage or brain disorder?"
Yeah, that's a very good question, Guja. As I told you that when meningitis occurs, it's got acute presentation. Acute presentation means what happens? The child has a high grade fever. The child starts with vomiting. There is a severe headache, and very soon the child goes into altered sensorium, means he goes into coma.
Oh,
And with less than 24 hours, the bacteria spreads in the body, spreads in the blood. So that is called bacteremia. And there are very meager chance that we can survive this child if not treated timely. Because after testing, sometimes the report comes after 3 days and we come to know, oh my God, this was, meningococcal meningitis. So that's the point. So that was acute presentation. But what happens in subacute presentation? In subacute presentation, this bacteria, which was now in the blood, goes to the meninges, starts inflaming meninges, and sometimes it get a chance to go down further in your brain, causing cerebritis. I'm talking a little scientific, don't mind. Cerebrum is a part of a brain which gets, if gets involved, gets inflamed, produces the symptoms of cerebritis. So sometimes when it trickles down in the brain and destroys that part permanently, causes lots of destruction there, the disease process there, then the remnants of this disease, although the child is being cured, but the remnants of disease in form of CNS disorders you can definitely see. And so in form of seizures, as I told you, and there are lots of other presentations, especially in CNS, which can be seen.
Gunja, I hope that answers your question. And doctor, there is one question that has come in now after the previous answer, and that is from Ankit, and he asks, "Why do we need this vaccine before a liver transplant?" I think you just mentioned it in the previous answer.
Yeah.
Yeah.
uh, the point is not that you need this vaccine before a liver transplant. This vaccine is needed by each and every child. I am advocating that. I never
Right.
miss any child in my OPD. I always offer to parents. This is my duty. I should inform parents. I should make the parents aware that this vaccine is being needed by each and every child. Now, then,
Right.
that's one to one discussion. After that, we go for this vaccination. So, the child who's going for a liver transplant, such
Mhm.
a major such a major surgery is going to take place in the body. His liver is going to be transplanted, and after a liver transplantation, he is going to be kept on certain drugs. Now, these drugs are called immunosuppressive drugs. So,
Right.
immunosuppressive drugs means they depresses your immunity. So, when your immunity is being depressed, as we talked in the beginning, in children, it's the
Mhm.
depressed immunity that allows these organisms to invade. So,
Yes.
what happens? A liver transplant patient is prone to get such infections because he is on long term immunosuppressive drugs. So that's why it's been recommended every 5 years in such children. So before liver transplant, yes. Even after liver transplant, we recommend this vaccine every 5 years. That's the concept because he's on immunosuppressive. Once he's off immunosuppressive, then that's a different scenario.
All
I
right.
hope I'm clear, Ankit.
Yes, I think it's fantastic how one question is leading to the other and so much information being
Yeah.
revealed. Thank you so much, Doctor, for that. Doctor, our next question is from Harleen. She asks, How can I protect my child from brain fever?
Right. I think we've been, it's again beating behind the bush. We've been talking this again and
Yes,
again.
yes.
Yeah, you have to protect your child from every disease possible. The dictum is this: every disease possible. So every disease possible means you have to avoid to the organisms being coming in contact with your child. So how will you provide that the organism doesn't come in contact with your child? You have to develop a protective protection circle around your child. And how will you develop that protection circle? No soap works. We have been seeing ads in the TV. Soap works. It's the hygiene. It's a hygiene which is very important. Okay, so you should have a knowledge first of all. It's very important. Followed by hygiene, knowledge of a hygiene, knowledge of a immunity, knowledge of a nutrition. After these things, please vaccinate your child. So the dictum, the mantra is vaccinate, vaccinate, vaccinate. Ek vaccine, one vaccine of COVID, has thrashed the whole world. We have been running haywire, because that has resulted into a pandemic. That has resulted into a pandemic. So when we have a weapon, why are we waiting for? We don't want to sit on the time bomb. Do you want to sit on the time bomb? No.
Not at all.
We have a weapon. We have a weapon. When you can afford to give a new dress to your child, I always tell my patients, yeah, it's a birthday. Yes. What are you getting him? Sir, a dress and this and that. Please give him a vaccine also. So that's the point. We can afford to give so many things, why can't we afford to give one vaccine which is against such a deadly disease? So that's the important concept. So this is how you can prevent your child from having a brain fever by maintaining a hygiene, building up a good nutrition, which gives a immunity, and vaccinate your child. Consult the doctor, consult the pediatrician. That's it.
Again, I love the analogy that you made, doctor. If you're giving your child a birthday present, give the gift of vaccination. I think
Yeah.
it's literally the gift of life that we are giving our children. So, thank you so much for that, doctor. Our next question, doctor, is my niece has been suffering from high fever. Can it be meningitis?
Right. So, as I told you, fever is a symptom. That's important. Okay, fever is a symptom. Not this
Right.
fever. What is important? Fever with associated symptoms tell us where is this bacteria is living in the body. Okay, that's what I told you. So if it's living in your tummy, you will come with loose motions and vomiting. So this organism is lying with a fever, loose motions, vomiting. But when you come with a fever, with headache, with vomiting, that's important. With headache, with vomiting. Now, these headache and vomiting are the symptoms which suggest that there is inflammation in your covering of a brain, which is scientifically, medically, we call meninges. So, when the associated symptoms, associated signs, when you bring your niece to the doctor, he will check, he will examine your niece, he will elicit certain signs which tells that there is a meningeal irritation. There's some meningeal irritation means there's some swelling, some cause which is irritating the covering of the brain. You know, so he can tell you yes. So definitely any fever can be a meningitis. You just can't neglect it. So you need to visit to a doctor. Please get her checked. It may be anything. It may be dengue. These days dengue is running very high. It may be a simple viral. So that's what the associated symptoms, the clinical examinations, the various signs, yes tells us. So खुदा ना खास्ता कोई ऐसी बीमारी हो 24 घंटे में कुछ गड़बड़ हो जाए. So we should not wait. Especially children are not miniature adults. Children are not miniature adults. That's very important to understand. They have a different physiology. They have a very small volume in the body. They vomit, lots of fluid goes out, which makes them dehydrated. Lots of fluid goes out, which makes them hypotensive, which we don't understand. So that's very important. So clear the concept. Okay? Please visit your doctor and get your knees checked. It can be anything, ma'am.
Thank you so much, Doctor, for that. For all the audience members who are just joining in, we are talking with Dr. Mohit Vohra about the right age to protect your child against brain fever. Doctor, our next question is does making alterations in our children's diet help to prevent brain fever? This
Diet.
is a typical
Oh
mother's question,
yeah,
I think,
yeah,
because
yeah.
all
It's
of
a
us
very
are
common
so
one.
worried about what our children eat.
Exactly. That's, I think that is a very, very important, aspect to deal with the child, to build up his immunity. Why, again and again, I've been telling you, why does a child fall sick? Why do you want to go to a doctor? Because your child is falling sick. Why did your child fall sick? The point is this. Because he was in contact with the organism. So when was he was your I need 100 organisms to cause. Your child needs 5 organisms to cause disease. Why? Because his immunity is already less. So what is important? You have to build up the immunity. How will you build up the immunity? What is the immunity booster? Is that papaya ka ras is a immunity booster? No, no. So immunity booster comes from the nutrition. That's very important. The genetics. If I have a strong genes, a strong family history, ठीक है, first to my genetic makeup, second is your nutrition. If you're just keeping a child on biscuits, milk, kurkure, that will never build up any nutrition, they will never build up any immunity. So for boosting your immunity, getting a chance your immunity, you must give certain food products, a balanced diet. I always tell my patients, dal, roti, हरी सब्जी, दूध, दही, फल, 5 आइटम लिख के आप अपने रसोई के दरवाजे पे चिपका लीजिए. Just stick these 5 things on the door of your kitchen. When you go at night to sleep, just see what I have not given to my child. And whose responsibility is this? So it's my responsibility, it's my failure, not my child failure. So that's what is important. If you're not giving any of these 5 things, you're missing out. That's your responsibility. Now plan next day how you are going to incorporate these 5 things in the diet of your children. Why? Because this balanced diets, these micronutrients, these minerals, these vitamins, gonna help to build up the immunity, which is protecting your child against diseases, and brain fever is one of those diseases. So yes, nutrition has a role in preventing that disease also. I hope I'm clear.
यस डॉक्टर एब्सोल्युटली ये 5 चीजें हम सब मम्मियाँ अभी एक पेपर पे लिख के अपने फ्रिज पे लगा देंगे सो दैट वी आर ऑल अवेयर ऑफ दीज 5 थिंग्स दैट वी शुड बी गिविंग आवर चिल्ड्रन. So
Great.
thank you for that, doctor. Next question, doctor, is are there any at home tips to fight brain fever?
Okay, there's lots of confusion. There's something called febrile seizures. Now, febrile seizures is a certain children, when a high grade fever comes, they throw convulsions. They मतलब तान आ जाती है, दौरे आ जाते हैं जब तेज बुखार आता है. Children are prone to. So this lasts up to 5 to 6 years of age. Start from 6 months onwards and last up to 5 to 6 years age, and after it doesn't last. So many a times we start calling these febrile seizures as a brain fever. The first of all, we should understand that these febrile seizures are not brain fever. Okay, वो चले जाएंगे 4 5 6 साल तक. So most of the patients ask me this question, कि what happens when. So when you have asked this question, whosoever, I think in the back of her or his mind is this, कि what I can do when my child is having a high fever and is throwing a fit. That's what it is. So when you are asking this question, there's a two different, phenomenon absolutely which you understand. A high grade fever with vomiting and a dull child. It's very important. Dull child. When the fever goes down, the child is dull. This is a bacterial infection. Fever goes down, but still the child is dull. This is in between the fever, child is not active, child is not playing, he or she wants to sleep. So that should, just allow. It is not a simple infection. That's very important. Take him to the doctor. Please don't do any intervention at home. I must do this, I must do that. Don't do it. If the child is dull in between the fever, take him to the doctor. That's very important. The question, the person who has asked the question, I believe, has some confusion regarding a febrile seizure. So, if it is a febrile seizure, means a high grade fever, and your child throws a seizure, a convulsion, a tan, please do not put anything in the mouth, first of all. People have, a tendency to put water, some drops on the face, in the mouth, so that what happens, it has a chance to go to the respiratory tract. That may result into aspiration, that may result into pneumonia. So that's very important. Never ever put anything in the mouth. Just try to, put the face on the one side, because the secretions in the mouth should just, come outside from the side. It doesn't get a chance to go into the सांस की नलकी में, respiratory tract. It should not go
Right.
into your trachea, the breathing tube. That's very important. So that's one thing. The child has a high fever and seizures, do not put anything in the mouth. Just, you know keep the face towards the one side. Then there are certain medical remedies which I don't want to talk on this platform. There are certain sprays which your doctor has given you that you need to give and take care of. And you have to give those sprays in the nose so that the child comes out of a seizure. Depending upon his age and weight, the doctor has already prescribed you. So, and after the child becomes a little conscious, take him to the hospital. Don't create a panic. If you create a panic, the things go on worse. So that's very important message. What happens? The child becomes, I've seen many times, fever with seizures. The parents go haywire. They get panicky. It's a natural response, a normal response. Maybe I would also like do that, but at the back set of a mind, I'm telling not to do that. That's what you should, whenever this is happening, you should remember. I think don't get panic. That's very important. So, if it is meningitis, no intervention home. Child is dull. The dictum is child is dull in between the fever. Take him to the doctor. This is some infection which is evolving. Child high grade fever with seizures. I've told you what to do. That's important.
Thank you so much, Doctor, for that wonderfully clear explanation. And with that, we've come to the end of the live session. There are so many other questions, but I feel we'll have to take another session just to clarify them. We've learned a lot today about meningitis, about brain fever. Doctor has told us that there are three types: fungal, bacterial, and viral. And then, of course, the importance of vaccines also to protect against brain fever. So, Doctor, I'd like you to quickly summarize the session for our audience who's still watching, and stress on the importance, please, of vaccination against brain fever for our parents.
Thank you, Namrata. First of all, thank you to your team for giving me this chance to come alive to the audiences. And I'm really happy to share that. And it was really very informative, very good questions being asked. I'm really impressed by the audience queries. The point is, the message has already been clearly given: vaccinate, vaccinate, and vaccinate. I'll still say I would just sum up in these three, words saying, please don't miss vaccine of your child. Whatsoever vaccine is available, whatsoever. It's not that it's not a compulsory vaccine, because compulsory vaccines are based on government policies. Okay, that's entirely different. I want to protect my child from this disease. I have to take care of my child. I cannot allow my child to suffer from this disease. What should I do? Today only, take your child. Be aware. It's given, the chart is always with all the mothers and the parents. Just see. 9 months, missed at 9 months. Don't kini ab to 9 months nikal gaye. I don't have to. Yeah, 2 years nikal gaye. Ab to nahi karna. No, no, no. This can be given. This can be given. Consult your doctor. Get your child vaccinated. That's the only point which I have to. Take care of hygiene, maintain their immunity, take care of diet, and vaccine. These are three weapons that will not allow you to take your child to a doctor. He'll be safe playing at home. So, all the best. Good day.
Some wonderful takeaways there, Doctor. I think all the parents have really understood the importance of getting the vaccine, the meningococcal vaccine, to protect our kids against meningitis. And also, I think you've shared some really relevant points about how to maintain hygiene and how to take care of our kids' nutrition, and signs to watch out for when a parent is suspecting brain fever in their child, how to deal with kids who are going through seizures. I think there's so much to take away from this session. But most importantly, like the doctor said, please follow the vaccination schedule. Parents, in consultation with your pediatrician, like the doctor has already mentioned, you can start as young as 9 months, go up till 24 months, and then get the booster shots as well with the consultation of your doctor. So thank you so much, Dr. Mohit Vohra, for such a wonderful session. It's been wonderfully engaging as well, and some fantastic points there. Parents and audience members who've tuned in, thank you for watching, and thank you for making it a wonderfully informative session. Stay tuned to more live sessions on Mom's Presso. We have lots more coming up. Have a lovely evening ahead. Thank you.
Thank you. My pleasure being there. Thank you so much.